Hi, I'm Brandy Dunham, coming to you from Angelo State University Counseling Services, and today I'm sitting here with Peggy Speetzen. Peggy is a licensed professional counselor, and she's been working here at ASU Counseling Services for almost 7 years. Peggy also has experience counseling at Hardin Simmons Counseling Center. How are you doing today, Peggy?
I'm doing well, thank you. Yourself?
I'm doing great.
Okay.
So I see that you have coffee. I'm loving the coffee for
do.
Counselor's Corner.
Uh-huh.
How do you take your coffee?
I take mine black with cream.
Ooh.
You?
I take my coffee usually on a calm, cozy day. That's how I usually take it.
Very nice. Very
Yeah.
nice. And that's a good time to have coffee.
Yeah, absolutely.
Yeah.
All right, so we're going to get on to the interview portion. So, Peggy, tell me about yourself. What inspired you to become a counselor?
I think what inspired me to become a counselor was growing up with a mother who was like nuts. Knowing what I know now, I think she was bipolar. So it was just kind of wanting to understand what she was going through, what she was experiencing, maybe what kind of stress she was under, and just all the different things like that. So
Okay.
that was cool. But life got in the way, so I got started late. But yeah, I think I had a bipolar mother.
Okay. Thank you for sharing that with us.
Sure.
Yeah. So, what psychotherapy framework do you prefer to use when you're counseling, and why?
Well, basically, I use like solution focused mixed with CBT because I'm also a believer that don't focus on just the problem, but you want to kind of look for some of the solutions as well.
Mm-hmm.
So, and not every theory or intervention works for every student. So you really do kind of got to mix it up a little bit, depending on your student. So we can talk about the problem and then, get to where we need to make that decision of, okay, let's focus on the solution, or let's focus on the decision that needs to be made.
Mm-hmm.
And that pretty much works for a lot of my kids.
Yeah, and so it's more goal focused, right? So, what's your goal with this situation? And then you focus on the solution. That's really,
Yep,
I like that.
absolutely.
So, what disorder would you like to discuss today, Peggy?
Well, today I'm going to talk about panic attacks versus anxiety attacks. A lot of people think they're like the same thing, but they're not.
Right,
Mm-hmm.
absolutely. And that is a big different, they are different.
They are.
And so, a lot of people do, they kind of use those things interchangeably, but they are very different.
Very much so. Yeah.
Yeah. So, can you tell me some key features about each?
Sure. So, where an anxiety attack is not really a disorder, it's just a symptom of anxiety.
Mm-hmm.
And the panic disorders, that is an actual diagnosis in the DSM, and they have like the panic attacks. They're very similar to the anxiety, but one lasts longer, one is more severe.
Mm-hmm.
So when people come in and say, "Oh my God, I had a panic attack," well, let's talk about your panic attack, right? And then the more you talk to them, you're like, "Well, it just sounds like you had a little anxiety. It wasn't like total panic attack where you were just debilitated, you know." So there's a big difference in that.
Okay, so one of them you're saying is like more of a heightened sense of fear and panic, and then the other one has more to do as a symptom of an anxiety disorder, possibly.
Yep, absolutely.
All right. How are they diagnosed?
Well, you want to do a lot of questioning for sure, to find out if there was any kind of an event or something that led up to how they felt or what they were feeling. And then kind of talk to them about what they think it was. Was it just maybe I had to talk in front of the whole class, giving a presentation? It's like, well, everybody panics doing that.
Yeah.
Not really panic, but you have some anxiety.
Mm-hmm.
But there are some people who do like freeze and it is like that heightened state like you were talking about. But there's certain criteria that also needs to be met for each, the panic attacks or the anxiety attacks. So you want to kind of look at that as well.
Okay. All right. Are there any assessments that would help you diagnose them from each other?
We have several different self-measuring assessments that you can do. They're just questions that you would go in and fill them out. One is like the GAD, the Generalized Anxiety Disorder Questionnaire. Another one would be like the Beck's Anxiety Inventory. Those are two popular ones. And basically they're just a bunch of questions you go in and answer, and they get scored, and it kind of gives you a little bit better idea how to diagnose people.
What do you think would make someone believe that they have had a panic attack or an anxiety attack?
Well, I have this awesome little thing here, and what it is it's panic versus anxiety attacks here. Okay, so although both of them, you will feel like your rapid heart, you've got your shortness of your breath, you're sweating, you're nauseous, you're dizzy, chest pain, like, oh my gosh, it's uncomfortable, because it is uncomfortable. So they both have those experiences, which lead people to say, I had a panic attack. Now, the difference between that, the panic attack is more where it starts, it's rapid, it's quickly. I can't read upside down. Within minutes, it's more intense. It's a physical, it feels like a heart attack or like life-threatening. Fear of losing control or dying. I think I'm dying. And sometimes you do feel like that. And it typically lasts for just a short time, than an anxiety attack. And it can actually happen without any reason, any trigger, anything like that. The anxiety attack, that happens more slowly over time. There's a general feeling of like restlessness or tension, like when you're talking in front of the whole class. Physical symptoms might be less intense than panic attacks. It's triggered by automatic, specific situations or events, and it can actually last for days, weeks, or months. So that's kind of like the difference. Like I said, they both feel the same, but the duration is basically the big one there. And did it happen quick, or did it build up over time?
Very interesting. And we will include a copy of that at the end of this video so that you can see it more up close. Okay. Is this disorder chronic? Does it last a lifetime, or what length of time would someone on average have panic attacks and anxiety attacks?
Well, panic disorder is considered a chronic mental health condition, meaning that it's ongoing and that it can last for a long period of time, which sometimes require just ongoing management, right? And that you can use therapy, medication together. Symptoms might fluctuate for sure, and it's not typically considered cured, and it can recur over time. Anxiety attacks, their anxiety disorders can be chronic, meaning that the anxiety persists for a long time, but anxiety usually goes away after the triggering event kind of goes away as well.
So like you're saying, when someone's doing a presentation for like the class, like for speech class or something like that, so that's a triggering event that could cause anxiety. So once you're done with your speech class and you go home for the weekend and you don't have another speech coming up, then it would kind of go away because it's triggered by an event.
Yeah, because you think about it, you're up there, you're presenting, and then you're done, you sit in your desk and you're going, oh, thank God I'm done.
Yeah.
Right? So like that triggering event has kind of gone away. As sometimes, though, the anxiety attacks might last longer. You might have to wait till you get home because my heart is still going 100 miles an hour, and it takes driving home and crawling into bed and watching TV or something to relax. We do have to remember to breathe too.
Right. Holding our breath when we have anxiety is a major thing that happens. So how are they treated? How do you treat panic attacks versus anxiety attacks?
Well, basically, the panic disorder is treated with the combination of therapies, like cognitive behavioral therapy, so that it kind of helps challenge some of those negative thoughts that you're having, along with medication. Exposure therapy is a good one, so that you're gradually exposing yourself to what it is that's giving you anxiety. Doing the presentation. The more presentations you do, the easier it gets. That first one is like terrifying, but by the time you get done with year 4 and you have to do a presentation, it's like, ugh, I'll just get this over with and be done with it, So, I mean, it's just kind of that exposing yourself to it. Medications, there's always antidepressants that can reduce the frequency or even the severity of the panic attack. Anti-anxieties do pretty much the same thing, but it's more short-term relief. And there are some beta blockers that can help, like especially like with the racing heart or the sweating kind of symptoms like that. Some other treatments, relaxation, right? Just deep breathing, meditation, yoga can kind of help reduce some of that stress and anxiety. Lifestyle changes, getting enough sleep, eating a good diet, exercising, right? And because that just overall helps with your mental health anyway.
Absolutely. So you named a lot of things, a lot of interventions that can be. But my next question was, what are some interventions you might try with someone who suffers? So I don't know if it would be redundant for you to say what you just said, but is there anything that you would want to add?
Support groups, I think, can also be helpful if you can find an anxiety support group. I used to be a part of one 7-8 years ago, I think. I helped run this group, and it was fascinating to get that group of women together and talk about some of the different symptoms that they were having. I remember one lady, like the shopping cart, she would wear gloves. She would take the wipes and she'd wipe the handle. She'd go through the grocery store and she'd just be trembling so hard just because being in that grocery store was so terrifying for her. Germs, stuff like that. So a support group is really helpful because she got a lot of good ideas from some of the other ladies that were there about what they did to kind of help with their anxiety as well. Sometimes avoiding caffeine, alcohol, smoking, recreational drugs, that sometimes can like trigger or even make your panic attack a little bit worse. Stress management, absolutely. Relaxation techniques, like I said, yoga, deep breathing, and there's different types of breathing that you can do. One of my favorites is the 5-finger one, because it also kind of helps with some of the grounding things that we talk about. As you're inhaling, you're feeling, you're touching, and sometimes it's visual, and then you hold, and then so it's like grounding and breathing at the same time.
I like
so
that.
That's like one of my favorite ones. Definitely get active, get up moving, go to the gym, go just walk around the campus. Any aerobic activity, that can have kind of that calming effect on your mood as well. And sleep, because if you're drowsy during the day, how awful is it to be sitting there in class and the professor's lecturing and you're like, then you're like, okay, so definitely try to get enough sleep. So those are just some of the ideas.
Lots of good ones for sure. Is this disorder one in which you might refer your student for medication management? Why would you, and why would you not refer someone for medication management for panic or anxiety?
I definitely think that depends on the client. Breathing and thought challenging can be different for some of our students or people. So maybe medication might be the route for them to go. Other students, we have, if you've ever been at Walmart to like the vitamin aisle, you will see a ton of herbal supplements. I have some students that take like ashwagandha for anxiety, kava for anxiety, and they're just natural things. They might just be temporary, but if you don't want to put like medication, prescribed medication in your body,
right,
sometimes those help. Always talk to a pharmacist at any place, and they will gladly walk you over and say, here, this might be good for anxiety, or here, this might be good. But But I think generally for panic disorder, medication and therapy actually works the best. I think anxiety attacks can be addressed and just managed through breathing and grounding. The 5 things you can see and hear and, stuff like that. So.
Right.
Mm-hmm.
Yeah. Can this disorder be mistaken for a different disorder? So can panic and anxiety attacks be mistaken for something different? Could something else be going on?
Well, panic disorder can kind of be misdiagnosed simply because, with that palpitating heart, that pounding heart, it could be mistaken for a heart attack. It could be asthma. You can't breathe, you start to panic. Maybe you're just having some problems with your asthma. Sometimes there's infections that can mimic a panic attack. There are some hormonal imbalances that can sometimes trigger that attack. Substance use, of course, always. We blame everything on substance use, right? Diabetes is another one that, when you tremble, you sweat, kind of the same symptoms of an anxiety attack. And even IBS, sometimes that can, you got the cramping and the fatigue and you're thinking that might be a little anxiety as well. PTSD, OCD, let's see, social anxiety disorder, which I think you talked to Colt about last time, can also be kind of just misdiagnosed as a panic disorder. Exposure to toxins, too. You always want to remember your toxins. That can contribute to a panic disorder as well.
For sure. And I think that a lot of times the most common one that I've heard of being mistaken is the heart issues, right? Is someone going to the clinic or the hospital thinking that they're having a heart attack and they're having a panic attack. And so it kind of, yeah.
Yep, and with grounding and breathing, you can pretty much usually calm yourself down.
Yeah. Does this disorder have any comorbid disorders that usually accompany it, or not usually, but can accompany it?
Well, panic disorder can be elevated in individuals with anxiety disorders, especially like agoraphobia, the absolute fear of leaving your own home. Major depressive disorder, bipolar 1 and 2, possible mild alcohol use disorder. It can also be comorbid. It's a day. With just medical symptoms, conditions like dizziness, cardiac arrhythmias, hyperthyroidism, COPD. I mean, so there's, because those are the things that we tend to associate, like, oh my God, maybe I have a heart attack, so that sends you off. So yeah, absolutely, medically as well.
Okay. Why do you like treating people with this disorder? What makes you enjoy treating people with this disorder?
I don't think it's a matter of liking to treat the disorder as much as it is to just make people aware that there are several different tools that can be applied to their panic attacks or anxiety attacks, breathing, mindfulness, exercise. I mean, they're there. You just need to remember to use them. Put them in your toolbox. The progressive muscle relaxation, the one that I use is laying on the beach with the waves coming in and bringing in the sand, and makes my feet heavy, it makes my legs heavy, it makes my knees heavy. That's relaxing. And there's so many different types of breathing techniques. You just pick out the one that works best for you and use that one when you start experiencing your anxiety.
For sure. And I personally like treating this disorder because you can see results. And I always like treating disorders that you are able to see results pretty quickly with the medication use alongside the therapy and the interventions and the techniques and the tools that you give our clients, that they are able to come back and say, you know what, I was having an anxiety, or I was going to have an anxiety attack, but I used the breathing technique that you said and it helped. And so that's always a pleasure to hear that our tools were helpful.
One of the big things that I hear from some of my students, I'm in the middle of an anxiety attack. What makes you think I can remember to breathe? And it's just like, breathe. Just breathe,
Yeah.
But and it's understandable, if you're drowning in the ocean, yeah, you're going to have some anxiety. Just remember to lay on your back and float if you have to.
Right.
But just remember to breathe. That's really the big one right there.
Yeah, and learning the tools is super important, and practicing using them.
Right.
Have you ever seen someone in therapy for this disorder, and do you want to tell a vague story about maybe someone that you've used, like a...
Yeah, several years ago, I had a student come in with some pretty severe, I'd say she was panic disorder. She had, she made herself a makeshift bed under her bed with blankets and pillows. She also had a makeshift area in her closet with blanket and pillows. And every time she started experiencing panic, she'd crawl under her bed and she'd stay there 12, 16 hours. Or she'd be in her closet 12, 16 hours, right?
Oh, wow, okay.
Yeah, she just really, there was a sheer panic for her. Um, and most of the time she would sleep, and she said when she woke up, she felt better. It was like the panic was done. It was just not there anymore. But then she came, when she started experiencing panic outside of like her room or whatnot, she started coming to counseling, and we worked so hard. She worked really, really hard. And we got her to the point where she was able to manage her anxiety or her panic. We got her on medication, and after, it was a trial for medication to find one that really, really worked for her, but she finally got one. She attended counseling services all 4 years. She graduated. She got a job with a company who actually understood the panic disorder, and they give her the time she needs if she starts to experience.
That's amazing.
Yeah, they let her just go in, like, a little quiet room, the bathroom, whatever, and they just let her, self-soothe. So it worked. I like to take credit for that too, but she did all the work. So yeah, it's nice to see sometimes that this stuff really does work. You just got to use it.
Yeah, that's a beautiful story.
It is.
That's a good
I miss
one.
her. She's doing really good.
I love that, and it's always great to see our clients end up doing amazing and working through things. So my final question for you is, what is your favorite quote to use in therapy? If I went and I polled all the hundreds of students that you've seen over the years, what would they say was a quote that you used?
I think my biggest one is, you are the story you tell yourself. And I think it's very fitting for anxiety, panic, because if you think about it, if you are telling yourself, these negative thoughts and stuff that are going through your head anyway, I am such a loser, you are going to live the loser story, right?
Right, yeah.
But if you tell yourself that you are strong, you're successful, you're going to live the story of being strong and successful. So that is probably one of my favorite ones. And then two, I think a lot of them will remember that I will say to remember to don't feed your problem with thoughts, but starve them with actions. Okay, so it's the thoughts creating the anxiety. Let's act on it. Let's do our breathing. Let's do our grounding. Let's do, whatever you've been, the tools you've been given in therapy. Use them, right?
I like both of those. Both of those are very, you're giving the client like all the power, and you're reminding them that they do have the power. Their thoughts have so much power. The way they think about things has so much power. And so I like both of those.
So you have to really remember to walk alongside your anxiety or your panic, and don't let that get ahead of you at all.
Yeah.
So walk alongside of it.
I love that.
Yeah.
Well, Peggy, thank you so much for sitting with us, and we'll see you next time on Counselor's Corner.
Thank you.